Hey, you know what time of the year it is. That transition to the 2021 ICD-10-CM and PCS manuals. The Inpatient Perspective System Final Rule, calendar year 2021, was released a few weeks ago. Well, today, let's dig into the ICD-10-CM official guidelines for coding and reporting. And stay until the end of the video, and I'll give you information on the 5 steps to become a certified marketable medical coder. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key. And on this channel, I provide you with information, tips, and strategies on how to become a certified marketable medical coder. As a result of my straightforward strategies, tips, and optimistic approach to education and learning, I've helped hundreds of students become certified medical coders who have developed dynamic careers in the business of healthcare and are valuable resources in their own right. Subscribe to my channel to get the latest and greatest information and tips you need to become a certified marketable medical coder. And don't forget to hit the bell for notifications of my weekly videos. The ICD-10-CM official guidelines are organized into sections. Section 1 includes the structure and conventions of the classification and general guidelines that apply to the entire classification, and chapter-specific guidelines that correspond to the chapters as they are arranged in the classification. Section 2 includes guidelines for selection of principal diagnosis for non-outpatient settings. Section 3 includes guidelines for reporting additional diagnoses in non-outpatient settings. And Section 4 is for outpatient coding and reporting. It is necessary to review all sections of the guidelines to fully understand all of the rules and instructions needed to code properly. Speaking of medical coding, if you are interested in getting medical coding education and training, and if you are interested in information regarding our online medical coding course, well, let me invite you to an online live Q&A information session, Saturday, September 26th at 10 a.m. Eastern Standard Time. To register, see details in the description box. And check this out. Are you confused about all the medical coding programs, but unsure what to ask? Do you want to make sure you get everything you need to learn medical coding and become certified? Well, join me on the last Saturday of every month at 10 a.m. Eastern Standard Time, where I will answer your burning questions regarding medical coding. Join our monthly medical coding course Q&A session. To join us, click the link to register. Can't wait to see you. There are 14 new guidelines and 8 revised guidelines. Revision Section 1B14, documentation by clinicians other than the patient's provider. For social determinants of health, such as information found in categories Z55 through Z65, persons with potential health hazards related to socioeconomic and social and psychosocial circumstances, code assignment may be based on medical record documentation from clinicians involved in the care of the patients who are not the patient's provider, since this information represents social information rather than medical diagnoses. Here is the change. Patient self-reported documentation may also be used to assign codes for social determinants of health, as long as the patient's self-reported information is signed off by and incorporated into the health record by either a clinician or provider. New guideline, Section 1C1G1A through K, all about the coronavirus infections. G is for coronavirus infections, COVID-19 infection due to SARS-CoV-2 2. Code only confirmed cases. Code only a confirmed diagnosis of the 2019 novel coronavirus, COVID-19, as documented by the provider or documentation of a positive COVID-19 test result. For a confirmed diagnosis, assign code U07.1 COVID-19. This is an exception to the Hospital Inpatient Guidelines, Section 2H. In this context, confirmation does not require documentation of a positive test result for COVID-19. The provider's documentation that the individual has COVID-19 is sufficient. If the provider documents suspected, probable, possible, or inconclusive COVID-19, do not assign code U07.1. Instead, code the signs and symptoms reported. See Guideline Section 1C1G1G, Sequencing of Codes. When COVID-19 meets the definition of principal diagnosis, code U07.1 COVID-19 should be sequenced first, followed by the appropriate codes for the associated manifestations, except when another guideline requires that certain codes be sequenced first, such as obstetrics, sepsis, or transplant complications. For a COVID-19 infection that progresses to sepsis, see Section 1C1D, Sepsis, Severe Sepsis, and Septic Shock. See Section 1C15S for COVID-19 infection in pregnancy, childbirth, and the puerperium. See Section 1C16H for COVID-19 infection in newborn, and we'll talk about those. For a COVID-19 infection in a lung transplant patient, see Section 1C19G3A, transplant complications other than kidney. Acute respiratory manifestations of COVID-19. When the reason for the encounter or admission is a respiratory manifestation of COVID-19, assign code U07.1 COVID-19 as the principal or first listed diagnosis and assign codes for the respiratory manifestations as additional diagnoses. The following conditions are examples of common respiratory manifestations of COVID-19. Pneumonia. For a patient with pneumonia confirmed is due to COVID-19, assign codes U07.1 COVID-19 and J12.89 other viral pneumonia. For a patient with acute bronchitis confirmed as due to COVID-19, assign codes U07.1 and J20.8 acute bronchitis due to other specified organisms. Bronchitis not otherwise specified due to COVID-19 should be coded using code U07.1 and J40, bronchitis not specified as acute or chronic. If the COVID-19 is documented as being associated with a lower respiratory infection, not otherwise specified, or an acute respiratory infection not otherwise specified, codes U07.1 and J22, unspecified acute lower respiratory infection, should be assigned. If the COVID-19 is documented as being associated with a respiratory infection not otherwise specified, codes U07.1 and J98.8 other specified respiratory disorders should be assigned. For acute respiratory distress syndrome, or ARDS, due to COVID-19, assign codes U07.1 and J80 acute respiratory distress syndrome. For acute respiratory failure due to COVID-19, assign code U07.1 and code J69.0 acute respiratory failure. When the reason for the encounter or admission is a non-respiratory manifestation, for example, viral enteritis of COVID-19, assign code U07.1 COVID-19 as the principal or first listed diagnosis and assign codes for the manifestations as additional diagnoses. For asymptomatic individuals with actual or suspected exposure to COVID-19, assign code Z20.828 contact with and suspected exposure to other viral communicable diseases. For symptomatic individuals with actual or suspected exposure to COVID-19 and the infection has been ruled out or test results are inconclusive or unknown, assign code Z20.828. contact with and suspected exposure to other viral communicable diseases. See Guideline 1C21C1, contact exposure, for additional guidance regarding the use of Category Z20 codes. If COVID-19 is confirmed, see Guideline 1C1G1A, screening for COVID-19. So during the COVID-19 pandemic, a screening code is generally not appropriate. For encounters for COVID-19 testing, including preoperative testing, code as exposure to COVID-19. Coding guidance will be updated as new information concerning any changes in the pandemic status becomes available. For patients presenting with any signs or symptoms associated with COVID-19, such as fever, etc., but a definitive diagnosis has not been established, assign the appropriate codes for each of the presenting signs and symptoms, such as R05 for cough, R06.02 for shortness of breath, R50.9 fever unspecified. If a patient with signs and symptoms associated with COVID-19 has an actual or suspected contact with or exposure to COVID-19, then assign Z20.828, contact with and suspected exposure to other viral communicable diseases, as an additional code. For asymptomatic individuals who test positive for COVID-19, see Guideline 1C1G1A. Although the individual is asymptomatic, the individual has tested positive and is considered to have the COVID-19 infection. For patients with a history of COVID-19, assign code Z86.19, personal history of other infectious and parasitic diseases. For individuals who previously had COVID-19 and are being seen for follow-up evaluation and COVID-19 test results are negative, assign codes Z09, encounter for follow-up examination after completed treatment for conditions other than malignant neoplasm, and Z86.19, personal history of other infectious and parasitic diseases. For an encounter for antibody testing that is not being performed to confirm a current COVID-19 infection, nor is a follow-up test after resolution of COVID-19, assign Z01.84, encounter for antibody response examination. For the applicable guidelines above, if the individual is being tested to confirm a current COVID-19 infection. For follow-up testing after a COVID-19 infection, see Guideline 1C1G1J. Revised Guidelines Section 1C4A3 and Section 1C6A. Chapter 4, Endocrine, Nutritional, and Metabolic Diseases. Sections E00 through E89 for diabetes mellitus, and the use of insulin, oral hypoglycemics, and injectable non-insulin drugs. Also, Section 6, secondary diabetes mellitus, and the use of insulin or oral hypoglycemic drugs. The revised information for both states: if the patient is treated with both insulin and an injectable non-insulin anti-diabetic drug, assign code Z79.4, long-term use of insulin, and Z79.899, other long-term drug therapy. If the patient is treated with both oral hypoglycemic drugs and an injectable non-insulin anti-diabetic drug, assign code Z79.84, long-term use of oral hypoglycemic drugs, and Z79.899, other long-term drug therapy. Another revision is in Section 1C9A3. Chapter 9 is diseases of the circulatory system, I00 through I99, specifically for hypertension and hypertensive heart and chronic kidney disease. The revised information states, for patients with both acute renal failure and chronic kidney disease, the acute renal failure should also be coded. Sequence according to the circumstances and the admission or encounter. A new guideline appears in Section 1C10E. Chapter 10 is diseases of the respiratory system, sections J00 through J99, U07.0. Vaping related disorders. So for patients presenting with conditions related to vaping, assign code U07.0, vaping related disorder, as the principal diagnosis. For lung injury due to vaping, assign only codes U07.0. Assign additional codes for other manifestations such as acute respiratory failure or pneumonitis. Associated respiratory signs and symptoms due to vaping, such as cough, shortness of breath, etc., are not coded separately when a definitive diagnosis has been established. However, it would be appropriate to code separately any gastrointestinal symptoms, such as diarrhea and abdominal pain. Another guideline revision is in Section 1C15K. Chapter 15 is the pregnancy, childbirth, and the puerperium. 000 through 09A. This revision states that code 085 should not be assigned for sepsis following an obstetrical procedure. See Section 1C1D5B, sepsis due to a post-procedural infection. Now, there are also more new guidelines, and we kind of talked about it on COVID-19. So sections 1C15S and Section 1C16H. COVID-19 infection in pregnancy, childbirth, and the puerperium. So during pregnancy, childbirth, or the puerperium, when COVID-19 is the reason for the admission or encounter, code 098.5. Other viral diseases complicating pregnancy, childbirth, and the puerperium. This should be sequenced as the principal or first listed diagnosis, and code U07.1 COVID-19 and the appropriate codes for associated manifestations should be assigned as additional diagnoses. Codes from Chapter 15 always take sequencing priority. If the reason for the encounter or admission is unrelated to COVID-19, but the patient tests positive for COVID-19 during the admission or encounter, the appropriate code for the reason for the encounter should be sequenced as the principal or first listed diagnosis, and codes 098.5 and U07.1, as well as the appropriate codes for the associated COVID-19 manifestations, should be assigned as additional diagnoses. And then with Chapter 16, certain conditions originating in the perinatal period, sections P00 through P96, for a newborn that tests positive for COVID-19, assign code U07.1, COVID-19, and the appropriate codes for associated manifestations in neonates and newborns in the absence of documentation indicating a specific type of transmission. For a newborn that tests positive for COVID-19 and the provider documents the condition was contracted in utero or during the birth process, assign codes P35.8, other congenital viral diseases, and U07.1, COVID-19. When coding the birth episode in a newborn record, the appropriate code from category Z38, live-born infants according to place of birth and type of delivery should be assigned as the principal diagnosis. More COVID-19 guidelines, Section 1C21C6, Chapter 21, factors influencing health status with contact with health services, Z00 through Z99. So observation. The observation codes are primarily to be used as a principal or first listed diagnosis. An observation code may be assigned as a secondary diagnosis code when the patient is being observed for a condition that is ruled out and is unrelated to the principal first listed diagnosis. For example, patient presents for treatment following injuries sustained in a motor vehicle accident and is also observed for suspected COVID-19 infection that is subsequently ruled out. Also, when the principal diagnosis is required to be a code from category Z38, live-born infants according to place of birth and type of delivery, then a code from category Z05, encounter for observation and evaluation of newborn for suspected diseases and conditions ruled out, is sequenced after the Z38 code. Additional codes may be used in addition to the observation code, but only if they are unrelated to the suspected condition being observed. And new guidelines, Section 1C22. Chapter 22, Codes for special purposes U00 through U85. U07.0 vaping related disorder, U07.1 COVID-19. So you have learned that there are 14 new guidelines and 8 revised guidelines in the 2021 ICD-10-CM official guidelines. You have also learned the ICD-10-CM official guidelines are organized into sections, and it is necessary to review all sections of the guidelines to fully understand if the rules and instructions needed to code properly. And lastly, you have learned that I will be hosting a live Q&A information session on Saturday, September 26th at 10 a.m. Eastern Standard Time to answer your burning questions regarding our online medical coding course. Check the link in the description box to register. Question of the day: do you have your coding books yet? Let me know in the comments below. I'm Clarice Warner, the girl with the pearls, the founder and education director of the Professional Reimbursement Network, LLC, where coding education is key, providing you with information, tips, and strategies on how to become a certified marketable medical coder. If you are interested in more information on these tips and others on how to become a certified marketable medical coder, well then check out these videos. And check this out.
Are you interested in medical coding, but not sure where to start? And scared of wasting time and resources? Let me help you with the right steps to become a certified marketable medical coder. Learn more at bit.ly/5stepscoder.
If you liked the information in this video and it was timely for you, don't forget to let me know by hitting the thumbs up, hitting the subscribe button, and the notification bell so you are informed every week when I upload new content. I love hearing from you, so let me know you were here by providing a comment or a question. You can also give me a little love by sharing this video on your social media platforms. Let's stay connected and connect others. Remember, be safe, be kind, and don't wish for it, work for it. Until next time, take care and thanks for watching.